Do you ever feel like no matter how much sleep you get, you still always look tired? Well, sometimes heavy eyes are not something any amount of rest will fix. So we met up with a local plastic surgeon who shows us how an English teacher changed her life and her look with a brow lift. Susan Chenard of Middletown is an English teacher who was referred by her eye doctor to Dr. Paul Stanislaw, a plastic surgeon in Avon.
It was just bothering me. You know, I just felt like my face was falling into my eyes.
Dr. Stanislaw gave her a brow lift, and unlike the old days, there's no shaving your hairline, and any scars will be invisible.
Make a little incision here, a little incision here, and then on the same side, a little incision and a little incision. You don't shave the hair or anything like that. Basically, through those little incisions, you come down and you free this area up here, and then you mobilize it and you suspend it up.
Look at Susan before. You can see why she felt so heavy in her eyes.
I was having difficulty, especially by the end of the day, correcting my English composition classes homework.
And just look at the results. Susan before and after. Wow. I noticed in the before and after pictures, you just looked happier.
Yes, yes, because I did kind of look serious, like kind of like the mean English teacher, and now it's like, oh, a happy person. Yeah, it's true. It's true.
Now you're the nice English teacher.
Yes, I'm the nice English teacher.
People come and say, are you tired? Are you angry all the time? And they may be well rested and they may be happy as can be, but just their brows are always hanging down. For a woman, the eyebrow should be above the orbital rim. There should be a slight arch, and the arch should be out over the lateral corner of the eye. For a man, it should be flat across and without an arch and at the orbital rim. So as women get older, this descends down, it becomes flat, and they compensate for it. They compensate for it by raising up their eyebrows a lot, which gives them a lot of wrinkles.
That was happening to Susan, but not anymore. Her brow lift opened her eyes and smoothed her forehead. You must be pleased that you also get to look a little younger.
Absolutely, that was a major bonus. It was, everyone was like, wow, what happened? You know, you're 10 years younger, and that was, of course, wonderful.
I would think most people, if they're thinking of a procedure they might want to get done, brow lift isn't even on their list. They don't even know what that is, yet this is something that can make a huge difference in people.
Right, well, most people come in, they say, well, I want my eyes done. I just want my upper eyelids done. And during the consultation, you have to just examine them and to figure out, well, what is it? Is it their eyelid skin? Do they have too much eyelid skin? Do they have a lot of brow ptosis? For most of it, it's a combination of the two.
Dr. Stanislaw determines what should be done in a consultation. Recovery is about 10 days, though for Susan, it was even faster. What's the reaction you've gotten from friends and family?
They're saying it's just amazing, you know, that it just, you know, it looks, you look so much younger, I can finally see your eyes.
Now she'll be much happier as that English teacher. Amazing how much it can change your face. For more information, you can contact Dr. Paul Stanislaw in Avon. We have his site linked to ours at betterct.com. Scott?
He's married, right, Karen?
Yeah.
Oh, that's too bad. All right, 20 things you should never have in your home. Is that right?
Yes.
The Queen of Canadian television is up next. Stay with us.
Little bound tininess.
Which way are you going to start?
Oh, I'll go this way. What do you think?
It's called the Irish curse.
Oh, stop.